Dr. Ricardo Komotar. Welcome to Neurosurgery Tales. It's
Hey,
an
how
honor.
are you?
Hi. It's an honor to have you here today to discuss not only your remarkable work in brain tumor surgeries, but also your insights on leadership, innovation, and probably a few of your passions outside of neurosurgery. So let's dive in.
Well, it's a pleasure to be here. Thanks for having me. It's a remarkable podcast. I've seen some of your prior guests, all friends and colleagues of mine, so excited to chat with you.
What inspired you to pursue neurosurgery? And if you weren't a neurosurgeon, what would you be doing?
I'd be an astronaut. Uh, I know it sounds crazy. I always wanted to be an astronaut, loved it growing up. And then
Mhm.
when I figured out that not every astronaut goes to space and that most astronauts end up working in an office, then there was no way I was going to do that work and not end up going to space. So then I switched over to neurosurgery.
So it's rocket science or brain surgery for you.
Exactly, one of the two. I think I picked the right one.
Yeah. What's the funniest or most unexpected piece of advice you would give yourself, your younger self, now that you've gone through the journey?
I would say having gone through the training that it takes to be a neurosurgeon, I would just tell myself, get ready to really work hard, harder than you ever thought you'd work. And I think you're going to get beat up along the way. And I don't mean physically, although sometimes, I mean, it is very physically taxing. I would say mentally, it's very demanding field, especially when you're training and you're learning. Everyone makes mistakes. There's a very small threshold for mistakes in neurosurgery. And so you're going to make mistakes, you're going to get beat down, and you got to bounce back up. So if I was to talk to myself when I was 25 and starting residency, or 21 and starting medical school, it would be, this is the right choice, but just get ready to undergo a lot of challenges
Mhm.
physically and mentally, but at the end you come out way stronger and a lot of growth occurs during that time.
Now you're one of the highest volume brain tumor surgeons globally. You perform more than 1,000 surgeries a year. How do you stay motivated and continually innovate in your practice?
Uh, I always tell our residents, if you're not moving forward, you're moving back. I think that in any profession, whether it's neurosurgery or business or law, if the moment you think that it's good enough and you're satisfied with the status quo, people are going to pass you. That's just the way it is. And so I always tell our trainees, the status quo is never good enough.
Mhm.
The surgeries that we do are never perfect. You can always make the surgeries better. You can make them faster. You can make them safer. You can make them more efficient. And with regards to our practice and our program, which is arguably the best brain tumor program in the country, it's never good enough. Am I
Mhm.
proud of what our program has accomplished? Absolutely. Do I think we have a lot of work left to do? Absolutely. And we're always looking to improve. So I think that motivation is something that never goes away, no matter how good your program is.
And how your philosophy on brain tumor surgery evolved over the years, especially when considering balancing between aggressive treatments and patient quality of life.
Definitely moving towards the more conservative side. I think
Mhm.
when you're a resident, you have a very limited view of what brain tumor surgery is about. You see the surgery, you're obviously learning how to do the surgery, and you're taking care of the patient in the hospital. You're
Mhm.
not necessarily seeing them post-op. You're not seeing them 2 weeks later, 2 months later, 1 year later. You're not dealing with the families like the attendings are. And so as a resident and as a junior attending, you're much more focused on getting a complete resection, getting a really good looking MRI. Oh, we did this and that. And it's kind of, you think that is your cachet. You think that's your currency. When in
Mhm.
reality, your currency is the outcome, the clinical outcome. And then as an attending, you quickly realize that um, yes, the MRI may look good, but quality of life supersedes a resection a million to one. And so you start having people who may not have an overt complication, but they're changed and they're different and the family's not happy. and you realize that there's no amount of tumor resection that is worth that type of outcome. So I would say over time as an attending, as you get more experienced, at least I have, and I think most of my colleagues have as well, you trend towards being more conservative. Obviously, you want to do a maximal safe resection, but quality of life and clinical outcomes always trump extensive resections, always.
Hmm. What have been the most valuable lesson you learned from working with specialists outside of neurosurgery in the treatment of brain surgery?
Teamwork, without a doubt. You in medical school, you think, and in residency, really, you think that neurosurgery is kind of a one-person show. The surgeon does the work, and kind of no one's really helping them. Again, because you're getting a very limited view into the care of these patients. As an attending now, I realize how complicated the care of these patients are. And so in neurooncology, in pituitary surgery, in metastatic disease, in malignant brain tumors, neurooncology, radiation oncology, endocrine, PT, OT, rehab. I mean, you really need a dedicated team to take care of these patients. So, one of the most important skills that I learned during training and as a junior attending, and we always teach our trainees is really teamwork, is
Hmm.
understanding that you have an expertise that's in the surgical realm, but these patients need radiation potentially. They may need chemotherapy, they may need all types of other treatments, and you have to surround yourself with experts in those fields. And no matter how good you yourself you think you are, if you're surrounded by people that aren't competent, your team is going to suffer and your outcomes are going to suffer and your patients aren't going to do as well.
Um, do you have any habits or routines that you rely on to stay focused and grounded both inside and outside the OR?
I think if you're going to be high performing in any field, and we're talking about neurosurgery now, but again, these paradigms apply to many different professions. I would say all professions. You got to take care of your body. And I
Hmm.
think sleeping right, eating right, and exercising are key for me to maintain a high performance level. And I think if you talk to people that are at the top of their game in really any profession, they really do take care of their bodies. It's not like they sleep 2 hours a day and they eat like crap and they don't work out. Usually these people are taking care of their bodies. And I think the concept of sound body, sound mind really goes together. So for me, um, I think I can perform the way I do because I take care of myself and I'm very regimented with sleeping usually 7 hours a night at least. Hopefully I can get 8, but usually it's about 7 hours. Um, exercising, religiously twice a day, and then eating right. And I think those things are really important to maintaining your overall performance.
How do you find time to exercise twice a day?
I get up really early. That's the first workout. And then in my office, I basically have a gym. I have a pull-up bar, a dip machine, an ab machine. So the second workout is as I'm in the office working or
Hmm.
in between surgeries or in between clinic patients. I think the answer to that is if it's important, you get it done. If it's not important, then you're not going to figure out a way to get it done. Which is what I tell people when they're like, "Oh, I don't have time to eat right. I don't have time to work out." If it's important, you're going to make it happen.
That's awesome. Um, we are now in the interview residency season. What qualities or experiences stand out the most when evaluating residency applicants? What makes a candidate truly memorable to you?
It's not grades, it's not board scores, it's not quality of medical school, it's not research, because a lot of candidates have those. The things that I look for, and I think many program directors look for, is that passion, is that grit, it's that drive. Neurosurgery, like I said, is a tough field. It's tough when you start, it's still tough for me now.
Hmm.
And if you're not able to take a hit, if you're not able to deal with challenges and bounce back stronger, you're going to have a lot of issues in neurosurgery. You're really not going to do well. I don't care how smart you are. or what med school you came out of, or how great your research is. If you are not able to bounce back from failure,
Hmm.
this is not the field for you. And so when we look at residency candidates, for me, I want to see signs of that resiliency. I want to see toughness. I want to see someone that I know is going to have setbacks like we all do, and they're going to come back stronger. So it's hard to kind of judge that, but that's a quality that when you see it, that's a candidate that you want in your training program.
And now, what advice do you have for students or probably residents navigating the neurosurgery residency interview process, especially such a competitive time? This year, there are 100 more applicants. So, any interview tips?
Yeah, I know it sounds cliche, but I mean, you really do have to be yourself. Other than that cliche, recommendations would be, you know, understand what you're applying for, and that's academic neurosurgery. You're joining a residency program. And so the things that people are going to want to hear out of applicants are academia, residency, hard work. This is your passion. When we get a sense that someone is doing this for a reason that they don't love it, but maybe just the title, the name, oh, their parents did it and they heard it was great, that person's not going to do well. So, my recommendation for the applicants would be focus on the academic part of neurosurgery, because that's really what we as program directors want to hear.
Hmm.
Research, advancing the field, and you have to show that you are able to work hard. You have to show that you're not going to complain. You have to. It's very much like the military. It really is, and I think neurosurgery in particular, it's a hierarchy. Um, you're going to have good days and you're going to have bad days. Early on, you're going to have a lot of bad days, and I think when people look at what makes a good soldier, it's a lot of the same things of what make a great resident. You listen, you take constructive criticism, and you improve, and you get up every day and you work your ass off. And I think those are things that as a program director, we want to see in our applicants.
What do you believe is the most important quality or mindset a neurosurgeon should have by the time they finish residency?
Teflon skin. I think you need to be able to, I think by the time you finish residency, you should be able to, for lack of a better term, take a beating. And if you didn't, if you're not ready to take a beating at the end of residency, then you went to the wrong residency. So I would say that, the quality, it sounds, again, it sounds kind of ridiculous, but it's
Hmm.
incredibly valuable in neurosurgery. When you finish training, you have to be able to make decisions, know that you're not going to be right 100% of the time, and there's going to be consequences to those decisions. You should be right the vast majority of the time, but no matter how good you are, no matter how experienced you are, no matter how world renowned you are, you're going to make mistakes, and some of your patients are not going to do well, and that hurts. You have to be able to be okay with that. And a lot
Hmm.
of people are not. And that's why I think neurosurgery is not about how smart you are. It's not about where you went to med school. It's not about how good your research is. It's really a mental game. It's a mental toughness and a grit. And so the number one quality that I want our graduates to have when they finish is the ability to make decisions under pressure and live with it. And that's not easy to do.
And for residents nearing the end of their training, what advice you give them as they transit into fellowship or independent practice? Is it the same or it's something else?
No, it's the same. I think it's a different it's a graduated responsibility. Obviously, people that are junior residents are not necessarily making the same level of decisions as chief residents
Hmm.
or fellows. But then you become an attending, and guess what? There's no one to make the decision for you. It's
Hmm.
you making the decision. And if you don't know the answer, you you can't call a friend. I mean, it's just that's your decision and you have to go with it. So, I would also advise as a resident to absorb as much as you can, because you're learning on someone else's dime. And
Hmm.
I remember being a resident, and you would operate, but you know, you wouldn't necessarily focus on the complications that you saw. You wouldn't necessarily enjoy rounding and seeing all those decisions. You were focused on what was happening in the operating room. And I can tell you, the moment you become an attending, that's the easy part of the job. Operating, being in the operating room, doing what you've done thousands of times, that's not the hard part. The hard part is dealing with complications, making decisions, tough decisions, clinical management on rounds in the clinic. So I would also recommend that residents and fellows really focus on how their attendings manage complications, because at some point in the very near future, that's going to be them. And they have to be able to learn on someone else's dime to make the best decisions once they're an attending.
And you have a significant platform on social media. How do you view your responsibility as a tough leader on social media, and what kind of impact do you hope to have through it?
I think social media has definitely gotten a bad rap when it comes to young adults and mental health and fake news and a lot of the
Hmm.
people who put out improper information. And I think all of that is true. However, social media is a very powerful tool. And I think it's our responsibility. And by ours, I mean experts in the field, whether it's
Hmm.
medicine, business, law, any profession. It's our responsibility to educate the public, because there is a forum out there with a lot of reach and a lot of power to reach the masses. And if we as professionals are not putting out accurate information and we're not educating the public, then who is? The people that are going to educate the public are the people that are not qualified, that don't know what they're talking about. And there's a lot of garbage out there. So the way I view social media is that it's a way for me to educate the public on what neurosurgery is and what brain tumor surgery is. And it's also a way to give the public an idea of what the life of a neurosurgeon is like, which I had no idea when I was training. There's no really way to experience it, but now social media gives us a platform to reach so many people and educate them. So I think no matter who you are, if you're an expert in your field, you don't have to do it every single day. You don't but you really should make an effort to be on social media, because your opinion and your information matters.
I can agree more with this.
Yeah, which is
We
why you
want,
probably
yeah.
started this podcast. I think one of the things that I enjoyed when I learned about your podcast was seeing what your mission was, and your mission to expose the public to what neurosurgeons are all about. And I think it's a
Hmm.
great idea. I think it's a great podcast, and kudos to you.
Thank you. And I also hope to inspire some younger generation of neurosurgeon, or probably students who aspire one day to become a neurosurgeon. I was an observer at the Miami University with Dr. Marcos, and I've heard during that time that you're an avid sneaker enthusiast. How did your passion
Absolutely.
for how did your passion for collecting sneakers begin? Are there any pieces that you keep for special occasions?
So I think as a surgeon, there's very few ways that you can show style. I
Hmm.
think it, in other professions, you're wearing a suit, you can wear different suits. Um, but in medicine, as a surgeon, you're coming to work in scrubs. At least I am all the time. And so there's very limited ways that you can show any type of fashion sense or style. It's basically your sneakers and your watch. I'm also big into watch, but those get pretty outlandishly expensive. So we'll focus on the sneakers.
Yeah.
To me, sneakers are one of the best ways that you can differentiate yourself and be unique and show some class and style. My favorite sneakers are Jordan 11s, um, Air Jordan 11s. Those are my favorite.
Hmm.
I also like Travis Scotts. I'm big into the Travis Scotts. Um, Dunks are always classic, comfortable.
Yeah.
Those are like your everydays. So I think between Dunks every day and then Jordan 11s and Travis Scotts on certain big operative days, that's the sum of my sneaker game.
Do you have a favorite color?
I like my sneakers loud, so usually red, yellow, something. Very few of my sneakers are just black and white. I have a couple,
Hmm.
but for the most part, they're loud. They're kind of obnoxious. That's the way I want them.
And I'm not really into watches, but if you can share your favorite watch, what kind of it?
I've been into this Breitling recently.
Mm-hmm.
It's a nice kind of piece that it's not too fancy. It's not overly expensive. You can wear it every day, take it off and on in the OR. If something gets on it, you just wash it. So Breitlings, Hublots, obviously a Rolex is a classic watch.
Yeah.
But probably my favorite is probably Hublot.
Mm-hmm.
Big fan of Hublot.
And lastly, if neurosurgery were a superpower, what superhero name would you give yourself?
That's a good question. Wow. I go with Iron Man.
Cool.
I go with Iron Man. I like the fact that he's unbreakable. And
Yeah.
obviously none of us are unbreakable, but I think that to what I was telling you before about neurosurgery, about how you've got to be able to take a hit
Mm-hmm.
emotionally, physically, all the above. I think Iron Man represents someone who's could take a hit, unbreakable, bounces back stronger than ever. So I think Iron Man represents neurosurgery pretty well.
That's awesome. Thank you so much. Thank you so much for your time and for sharing everything with us.
Oh, this was a blast. Thank you so much. I look forward to seeing the final edition and seeing who else you have on here. You've already had a stellar list of neurosurgeons, so great job getting your podcast off the ground. It looks great.
Thank you.